Hey, what's going on, guys? Happy Wednesday. Dr. Nathan Thompson here with Exemplifies Health Center. Hope you guys are having a fantastic Wednesday afternoon. Happy hump day. So today I'm going to go over an interesting topic, and it has to do with headaches. And I'm going to help guide you through kind of this maze of headaches and why you should be looking at very specific areas when it comes to understanding where headaches are coming from, why you get them, and what you need to do in order to start correcting this. Listen, I understand this and I get this as that headaches are absolutely debilitating. I know that I suffered with headaches in the past, and I'm going to show you why I did. I know that my wife, Barb, my lovely wife, Barb, I remember when I met her, was suffering tremendously with migraine headaches. And we're going to show you where we looked at, but also other places where you need to look at and why it's just not related to your mental stress. All right. So let's talk about headaches a little bit. Hopefully you guys can follow along with me. And if you have any questions, make sure that you leave a comment below. Thank you, Ashley, for tagging someone. So tag someone who you know is having headaches so that they can go back and watch this video and be able to get some answers when it comes to headaches. So I want you to stay with me because I'm going to guide you through kind of how we determine where the headaches are coming from and also what you can do in order to start working on correcting this. So let's talk about headaches. Hey guys, headaches are absolutely no fun, right? I remember 15, 16 years ago when I met my wife for the first time. I remember, after a couple of times of dating her, she said, hey, I suffer with migraine headaches. And she said, I get these migraine headaches once or twice a week. And what happens is I see that this migraine headache is coming on. So I feel it. I have this aura that's coming on. And then all of a sudden it just hits me like a ton of bricks. The pain is so intense. Usually I'll vomit and then I have to go into a dark room. There's a reason for that, by the way. I have to go into a dark room, a quiet room, and I have to do nothing or sleep for 3 hours, and then basically for the next day or two, I'm absolutely useless because I have no energy and I'm absolutely exhausted. So there's different kinds of headaches, though. So you have your tension headaches, you have your migraine headaches, you have your exercise-induced exertional type headaches. And so let me help you navigate to see kind of, hey, what's the cause of these headaches that are actually going on? So let's talk about headaches. But before we do that, I want to go to the number one Google search engine when someone has headaches is that Google's going to take you to WebMD. And the reason why I want to bring up WebMD is because that's where people are getting most of their medical advice from. And if someone has headaches, they want to know, hey, what is this being caused by? And, what can I do in order to manage it? But here's what's interesting. Here's what they say. So number one, WebMD says you can have a headache that's caused by an illness, like infections, colds, fevers, with sinus infections, things like that. It can also be caused by a blow to the head, right? Like a concussion. Now, remember this, if you have a concussion, whatever concusses the head is also going to displace the neck. Now, make sure that you remember that. It can be due, they say, to emotional stress and depression. It can be due to your environment, like secondhand tobacco smoke, strong smells like household chemicals or perfumes, allergens, and even they say what's interesting is certain foods. So they say it's illness, it's stress, it's your environment. And then they come to something that's very interesting, and they say this. They say genetics. They say headaches, especially migraine headaches, tend to run in families. So they say that headaches definitely are due to genetics. But if you go to the right below where they say it's genetics, then in the same page, they say doctors don't exactly know what causes migraines. So they say that definitely migraines are being caused by genetics, but we actually don't know what causes migraines. So this is what's interesting is they're saying we know what it's caused by, but yet we really don't know and we don't understand what it's being caused by. So this is what's interesting is that you go onto WebMD, you're going to get all of these differing opinions that are contradicting each other. And it is no wonder why so many people are confused when it comes to headaches and migraines and causes and obviously solutions. So obviously you're going to go on to WebMD, and they're going to give you all of the solutions that are actually going to cause you to fail so that you give up and just resort to medication for the rest of your life. So I remember when my wife was having migraine headaches, she was actually taking prophylactic Imitrex. So she was actually taking a dose of Imitrex every single day just to keep her migraines from being absolutely debilitating. It didn't take away the migraines, but it made them kind of manageable. So it was kind of like the fire department not putting out the fire, but just putting out enough of the fire to where you kind of can live in another room, but not in the area where there's a fire. And so when she said, well, how long do I need to be on this Imitrex? They said, well, you're going to have migraine headaches for the rest of your life, and you're going to need to be on these different medications. So it's no wonder so many people are so confused when it comes to headaches and things like that in general. Now, listen, there really is going to be two main causes. All right. So again, guys, if you know someone who has headaches or migraine headaches or things like that, let them know the headaches are common, but they are not normal. So in the comments, go ahead and put, hey, tag that person and say headaches are common, but doesn't mean that they are normal. So I remember when my wife, when she was suffering with these migraine headaches, she had suffered for a little while. And by the way, when I asked her, I said, well, when did these migraine headaches start? She said, they happen a couple of days after I had a trauma. And I said, well, what kind of trauma is this trauma that she had? Like, what kind of trauma was it? And she said, I fell backwards and I landed on my neck in a flex position like this, and then I landed on my head. So here her head was actually forced forward and her body weight landed on top of her head. So she had trauma. And where was this trauma actually located? Well, the trauma was located in the upper part of the neck. So the trauma was in the upper part of the neck. Here's what's interesting, is that when you look at the two really big reasons why someone is going to have any kind of headache for that matter, it really has to do with this. It has to do with a loss of vascular and nerve supply going back up into either the muscles around the head or deep inside into the brain. So there's going to be some lack of nerve supply or some kind of vascular supply that's going to be going to the head. But the second reason too is that it could be because the body is actually trying to, I don't want to say detox, but the body doesn't have something that it's used to. And that when you're deficient in what it's used to, sometimes you can start to have headaches. I'll give you an example. If you have 2 cups of coffee every single morning and you have that caffeine, as you start to withdraw off of the caffeine, you can get a headache. Here's another one. If you've ever heard of rebound headaches, in fact, they've actually found if you're taking your Motrin or ibuprofen, Advil, you're taking those things every single day for some kind of chronic pain or for a headache, what they actually found is that when you don't take it now every single day, is that you experience rebound headaches. So you're actually getting a headache not because you have a decrease in nerve or vascular supply. You're getting a headache because the body actually wants more of these drugs. And so now some of the things that you're taking it for could actually be caused by it. So it's going to be either kind of some kind of deficiency, or your body doesn't have caffeine, or it doesn't have a drug or a medication. So anytime that you're having a headache, there's a lot of different reasons why, though, that you could start to have some kind of headache. So I want to show you this something, and we call this right here, we call this the Swiss watch principle. Okay. So, when my wife was suffering with migraine headaches, they referred her to a neurologist. And basically the neurologist did one thing. They looked at her head. So they looked inside the brain and they couldn't find any fires inside of the brain. So they told her, you're fine. We don't see anything wrong. We don't know what's being caused by this. However, we do know that you should just take these medications and will help you manage this for the rest of your life. And if you're sick and tired of managing your sickness and managing your illness, give me a thumbs up, because there are so many people who say, I don't want to manage disease. I actually want to find causes and start to correct it. So the problem is that we then start to go to specialists who then go deeper and deeper into one organ system and look at the organ system and try to figure out if there's something wrong with the organ system. Meanwhile, they neglect how the whole entire body starts to work together as one unit. And in fact, I'll prove it to you right now, is when I tell people, hey, your big toe, did you know it controls your heart? And people laugh. They say, that's funny. Your big toe doesn't control your heart. You know what I tell them? Let me smash your toe with a hammer and let me see what happens to your blood pressure. So if I put a stress, and I put some kind of stressor on the big toe, you're going to see changes everywhere else take place inside of the body. And that's why when it comes to any single health condition, you have to look at the whole entire system as a whole. The hormone system, the digestive system, your skeletal system, your skin, your immune system, muscular system, your lungs, your heart, all the way into your nerve system, and to figure out, well, what is happening here and what's happening in your other organ systems, because sometimes the problem isn't where you're having the symptom. The problem is in a different organ system, and it's causing a symptom to take place somewhere else. And so that's why when it comes to headaches, you have to look into the nerve system. Heck, you even have to look into your digestive system. You have to look at all of these different areas to see, why is the body telling me this? Why is there some kind of symptom that's going on? And why is my body trying to adapt in this manner that's actually saying, hey, we're starting to get headaches? So biggest thing that I can tell you is what is going to cause headaches? Well, there's going to be inflammation. And so that inflammation can be caused by physical traumas. So I want you to think about it. My wife had a physical trauma to the head and to the upper part of the neck. And the doctors looked at the head, but they never looked in 2 inches below to the upper part of the neck. So my wife had a severe issue in through the upper part of the neck that controls the vascular supply that goes back up into the head. Those same nerves that go back up into the head, here's what's interesting. They also control the eyes and they also control the ears. So when she would have a migraine headache, those nerves would become hypersensitized. She also, the same part of that neurology would become extremely sensitive too, which was her eyes and her inability to be able to deal with light and her inability to be able to deal with loud sounds. Think about it. You have a migraine headache and you're sensitive to light, to sound, and you have tremendous pain, sometimes in the back of the head, and a lot of times it's going to radiate around in through here. So it can be physical trauma that happens to the neck. How about this? How about dental trauma? So no one ever looks at dental trauma, but if you've had any kind of blow to the jaw, or you've had to open your mouth for 2 hours to get a tremendous amount of dental work, those people can start to have headaches right in through here because your jaw, the muscles actually connect to your jaw, and you tend to have a lot of symptoms of headaches when it comes to in through the temples. So there's going to be some kind of physical trauma that's going on with headaches. In fact, I would say that almost every single headache that takes place has some level of physical trauma that's involved. Here's the other one. How about any kind of chemical inflammation that's taking place? And let me give you an example. So if someone has a lot of digestive issues, let's say they have multiple food allergies, they have leaky gut or intestinal hyperpermeability, maybe even a small intestinal bacterial overgrowth. But any of those things can lead to a lot of inflammation taking place in your gastrointestinal system, in your small intestine, in your large intestine. So what happens anytime there's an inflammatory response, then you have to have an increase in blood supply that's going to that specific area. So if you are having a constant inflammatory reaction that's taking place in the GI system, then what that's going to do is that's going to start to shunt blood away from the extremities and also away from the head. You have a decrease in vascular supply going to the head, then even having problems with your digestive system can also cause headaches. And here's the third one. The third one is mental. So I have had headaches before that are purely based on the amount of mental stress that I have. I know it's really hard, isn't it, to understand that I would actually get stressed, but it's true. It is true that sometimes I do get stressed. Now, whose fault is it that I get stressed? It's my own. It's not my circumstances. It's not my environment. It's when mentally I am not adapting well to my environment. And usually the problem comes back to me because many times I put too much on my plate. But let me talk to you about mental stress. Because when you start to have this mental stress, your body does not care if it is mental stress based off of your job, your kids, school, finances, whatever it might be. The body doesn't differentiate between that kind of stress and the stress of a bear that's chasing you. The physiological response to any kind of mental stress is going to be the same. And it puts your body in this fight or flight response, meaning the body goes into protective mode. So I want you to think about it. If someone was going to do this and rear back and was going to punch you, chances are, if you've never had any kind of martial art training or fight training or boxing training or anything like that, chances are your response is going to do this. So you're going to protect yourself. And when you think about it, when you're having a tremendous amount of mental stress, that stress will actually get dissipated into around all of the muscles around the spine to go into protective mode. So when you're stressed, you typically are going to go into lockdown, where the head starts to go forward, the shoulders start to round, and you do that in order to protect your vital organs inside of your body. So it has to be physical. There's also a chemical component, and then there's also a mental component. And how many do you have to address? You have to address all three, because there's so many times where someone says, oh, I'm having this health issue. I want to get a food allergy test. And somehow they think that that's the only stressor that's taking place inside the body. That may be one stressor, but it might not even be the main stressor. So it's our job to see what are the biggest stressors that are taking place. Is the biggest stressor physical? Is it chemical? Is it mental? Or is it a combination of all three? And that's why when it comes to headaches, you have to address all of those three things. So the first thing is what can cause headaches? Well, this is physical trauma. So when you look at physical trauma alone, this is a huge indicator. So if you would look at somebody from the side and you drew a plumb line straight down from the ears, you should see that the head should be directly over the bottom part of the neck and directly over the pelvis. And what you see in what is called forward head posture is you see the head starting to jut forward in front of the body. Now, a lot of times this can be caused by car accidents. This can be caused by sitting at a desk for too long. This can be caused by always being on your phone with a head down tight position. So you see the head goes really forward, and then you see a rounding of the upper back. We actually call this rounding of the upper back. We call that the granny posture. And I know, ladies, if you are scared to death of the granny posture, give me a thumbs up. Because the granny posture not only looks bad, having a giant hump on your back, but it also functionally is bad, because what happens is that as it progresses, it's going to lock down on this upper part of the neck. And you see all of these nerves in through the upper part of the neck that innervate the skull. Now, if you're someone who gets headaches in through the back of the skull and sometimes radiates around towards the eyes, chances are your biggest stressor is going to be having this granny posture or in this head forward position. So you have to do the right type of adjustments and rehab to start to actually correct that. Now, let me give you an example. This is a guy who comes in, and when we took x-rays, he was having terrible, terrible migraine headaches. And so you can see, here's the eyes, here's the teeth, here's the back of the head. And you can see on his x-rays how far forward his head was in front of his body. And that was actually causing severe damage up and through here. And you see these two lines both have to be parallel, so you can see how much misalignment was taking place in through the upper part of the neck. You also see it had been going on a long time, because you can see he's got a horn growing in the back of his neck. And you also see calcification of this ligament, and which means that there had been at some point some significant trauma in through the upper part of the neck. And this was actually causing terrible, terrible migraine headaches. So when we did the right things, you can see that all of this, his head came back over the body, posture got corrected, and the headaches went away. Now, here is the thing. Everything was going great for about a year and a half, and then for about 2 years. And then he comes to me and says, "Hey, Dr. Nate, I feel great all the time, except when I work out." He said, "Except when I work out." And he said, "When I work out and my blood pressure goes up, and I need all of this blood to go to my extremities to be able to work out, to be able to lift, and to do high intensity exercise." He said, I'm getting a massive exertional headache. Like, the pressure in my head is so severe. It starts in the back and it wraps around, and it just feels like there's a vice, and it takes me about 30 minutes to recover afterwards. And he said, this is happening literally every single time I exercise. So I got to thinking, and I thought, well, what could be causing a lack of vascular supply going to the head? Because remember the causes of the headaches. And then I thought, well, maybe he has a bunch of blood and inflammation taking place in his tummy, in his gastrointestinal system. So here's what's interesting. When we took an x-ray of this, normally on an x-ray, you should see everything is nice and gray in through the soft tissues. So this should be all nice and gray in through your tummy. And when you look at this, you can see all of the gas and the bloating in the large intestine, in the stomach, and the small intestine. And so you can see that when you see those black areas, that is a presence of a lot of intestinal inflammation, which means all of the blood is going there, and he's got nothing left for his head when he actually exerts. Now, here's what's interesting is we did what's known as an IgG-IgE food allergy test. Now, this is not something that you can get online. This is not something that you get from your medical doctor, because they're testing only 1% of your immune system when they do any kind of food allergy testing. And this is a complete testing of IgE and IgG food allergies using a blood draw, not a blood spot. And in order for it to be positive, you have to have 4 separate positives in order for it to register. So when we did his food allergy testing, you can see that he reacted to apples. He reacted to blueberries, a lot of fruits. You see, he reacted to casein, which is the protein in cheese specifically, even to kale and to a lot of nuts, and some tuna. And you can also see that he reacted to things like baker's yeast and brewer's yeast. So it's no wonder he would have a headache if he would drink beer. Now, if anybody has a high amount of, has a food allergy to any kind of yeast that's taking place, like baker's yeast or brewer's yeast, the first thing I look at or have to tell them is I say, you are eating too much sugar and you're eating too many carbohydrates. And those things are creating inflammation inside of the body. So he has 29 different food allergies, and every single one of them, when he would have it, would make him swollen, would make him inflamed, and would shunt all of that blood away from the rest of his body to go into the gastrointestinal system. And that was the reason why he was having those exertional headaches. So guess what? We helped him avoid those food allergies, taught him how to replace that instead, did some things in order to help his body digest his food better. And guess what? Now, no more exertional headaches. And I remember he came back to me. He said, you know what? I love working out. I love CrossFit. And I thought I would just have to deal with this for the rest of my life. So remember this, is that headaches are not just caused by foods. Headaches are just not caused by, many times, just the nerve system. Headaches are not just caused by stress. Is that most of the time it's a combination of physical traumas, chemical inflammation, and having a high amount of mental stress. And when you take all of those threes, you have a perfect storm for you to have headaches. Listen, if you need an answer when it comes to headaches, what I want you to do right now is I want you to message me. So send us a message, and we'll get back to you as soon as we can, and let us know how you need help with your headaches. And even if you're from out of town, let me know too. We'll try to find someone who can help you. Hey, if you're watching the replay right now, go ahead and type in replay so that I know you're watching this afterwards, and make sure that you like this and share this, or tag someone who is suffering with headaches and let them know you don't have to suffer anymore. Just think about this. What if you didn't have to suffer anymore? What would you like to do even better? And if you can find your cause, your life will be so much better. So, hey, this is Dr. Nathan Thompson again with Exemplify Health Center. You guys have a great Wednesday, and we will talk to you soon. Be well.